everybody and welcome to this lecture. Today's topic is fascia, and to discuss this topic we need to answer a few questions. What is fascia? Where is it found? What are the types of fascia? What best describes each type? And what are the functions of these types? So, what is fascia? Fascia comes from a Latin word that means band. So it's a band or sheet of connective tissue that binds your organs or tissues together. It envelopes your body. It makes it a single continuous unit so that you can run, surf, or even fly without having to collect your organs from all over the place. Now, fascia doesn't only connect your body organs or tissues. It also has important and various functions. Like it contains enormous number of nerve endings so that you can sense your body. So it's not just that boring filler tissue that is thrown away to make a clearer vision of whatever inside. It's an actual important organ. Now, where is it found? It's obviously found everywhere in the body as it connects tissues or organs together. So we need to classify fascia to know where exactly is every type, and what are the functions of these types. Fascia is classified by layer into the layer just beneath the skin, which is superficial to everything else, and is so-called superficial fascia. The layer beneath it, which is deeper to it, and it's called exactly deep fascia. So we have a superficial fascia and we have deep fascia. What about the layer that is inside your body, that envelopes the organs? It's internal fascia. It's termed internal fascia. Now, we're going to talk about superficial fascia. The superficial fascia is that layer present just beneath the skin, and it's formed of loose connective tissue that differs from the deep fascia, which is dense or organized fibers or membranes of connective tissue. The superficial fascia is loose. It contains a large amount of fat or adipose tissue. That's why it's loose. So, this layer, which is a superficial fascia, is present just beneath the skin. And the term for that is subcutaneous. Subcutaneous means beneath the skin. Cutaneous means skin. So the superficial fascia is the subcutaneous layer of loose connective tissue that is formed of large amount of fat. And is it found, or is it of the same thickness all over the body? No, it differs considerably between one area in the body and another, and it varies also between one individual and another. So in general, it's more in females than in males, and it's more in the breast or the abdomen than in the limbs. And there are some areas or sites that is devoid of superficial fascia. That means it has no superficial fascia. What are these sites? Let's think a bit. Where do you think? Superficial fascia is not present, or it forms a thin layer that is devoid of fat, so it has no fat. In the eyelids, can you imagine a person that has fatty tissue stored in his eyelids so that whenever we get fat or whenever we get obese, we just can't open our eyes? and we need to lose weight to be able to wake up in the morning. So obviously this cannot be the case. So the eyelids is devoid of fat or fatty tissue in the superficial fascia. Where do you think? In the scrotum. The scrotum is devoid of superficial fascia. Why do you think is that? The scrotum is the site where the testicles migrate to be able to perform its function with a temperature that is lower than the body's temperature. So, shall we cover it with superficial fascia that has a large amount of fat and that makes the temperature in this area increase? Of course not. So, the scrotum and also the penis are devoid of superficial fascia. Now that we understand the distribution of the superficial fascia, we need to know the function of the superficial fascia. The functions of the superficial fascia are to know the function of something or somebody in your life. You need to imagine your life without that body. And to know the function of something in your body, we shall imagine that body without that thing. So, let's imagine a body without the superficial fascia that is beneath the skin. Of course, the skin will take the ridges and the protuberances, the crests, everything of the bones below it. So it gives the body its contour and its soft surface. That's a function. It allows mobility of the skin over the underlying structure. It also connects and enables nerves, blood vessels, and lymphatics to go to and from the skin. So it transmits nerves, lymphatics, and blood vessels to the skin. Now, we imagine the body without the superficial fascia. There's actually a case where a fetus can be born prior to the formation of the superficial fascia. That's preterm. And we keep these preterm babies in the incubator to keep them warm. So now we know the second function. It's to keep the body warm. How does superficial fascia do that? Superficial fascia has a large amount of fat and it acts as a heat insulator. It insulates the body from the temperature outside so that we can't just change our temperature by the environment. It also helps keeping the body's temperature by another mechanism. The vessels that pass from within to the skin that's present in the superficial fascia, and it's termed the subcutaneous vessels. These vessels can expand, or what we call dilate, and it can constrict, limiting the blood flow to the skin. So whenever there's a cold weather, these vessels constrict. It limits the blood flow to the surface or to the skin to prevent the heat loss from this flowing blood through our skin. So it prevents this heat loss. And the reverse occurs whenever there's a hot environment. These vessels dilate and more blood flushes through your face or your skin. So this mechanism is called heat regulation. So superficial fascia has an important role in heat regulation. Now, it also keeps our body warm by another mechanism. The fat that is present within this fascia can actually metabolize, and it can give ATPs, adenosine triphosphate molecules, that is the source of energy in the body. So the fat within the superficial fascia can form energy. It also contains glands like sweat glands and the mammary gland that is present within the superficial fascia. And it contains muscles, as for the muscles of facial expression. Now that's it about superficial fascia, and we'll continue our talk about deep fascia in the next video. So thank you for watching and see you next time.